We are here at VMX, and I wanted to introduce you to Kurt Oster. And Kurt, can you kind of tell us your history just in the vet field, what you've done, and just kind of how you've moved through the industry and what you do now?
Sure, I'd be happy to. I'm a little embarrassed to say that I've been at this for 40 years. I started managing my first hospital back in 1983. It was an equine referral surgical practice. I've done mixed animal practice, general practice, and I've spent the last 25 years at 24-hour emergency specialty hospitals. And now I've come full circle back to mixed animal practice again.
So you've been in the industry a really long time. Can you tell us how you were introduced to gas sterilization, what you did back then, what you're doing now with it, how it benefits you and the practices you work with?
Sure. Back when I started at the equine surgical practice, that was when veterinary medicine started using the plastic disposable staplers. And as you know, in human healthcare, everything is disposable. In veterinary medicine, we tend to use it over and over again until it's exhausted or broken or whatever. So with the plastic skin staplers, we were first gas sterilizing those along with some bandaging materials and stuff like that. And then, over the years, it's been more and more equipment up to endoscopes and so on. And now the big item, the hot item is vessel sealers. Again, disposable in human healthcare, but in veterinary medicine, we might use them over 10 or 15 times, and gas sterilization makes that possible for us.
Gotcha. And do you see using gas sterilization for those hand pieces? Can you kind of tell us how it benefits the hospital financially and infection-wise for your patients along those lines?
Yeah, the cost of those hand pieces, they're $650, $700 a piece. So disposable, especially if you're going to use them for spays or pyometras or even a splenectomy, it's not really cost effective. But if you can get 10 procedures out of that piece and maybe get the cost down to like $60 or $65 per procedure, or even as many as 15 uses, it makes it much more economical and much more affordable, and it allows us to use technology in veterinary medicine that we probably wouldn't be able to because out of human healthcare, because it would be cost prohibitive. So it really makes improving the quality of the medicine and the care you provide affordable, because we can bring things from the human world into veterinary medicine.
Oh, that's great. And as far as our sterilizers and just the technology over the years, has it been easy to work with us as far as training, being able to get your technicians up to speed on the use of this units, getting them trained, just things like that?
Yeah, we've had really good experiences with you guys for decades, for as long as I've been around. They've had a great training program for the users. So, every place I've been, a number of techs have gone through the training program and gotten their certification and been able to use the system. I have to say that, the places I've been, we've worked the units really hard, as many as, 5, 6, 7 cycles a week easily. And the units have held up really well. If you ever do have a problem, the troubleshooting and technical support's been right there. We've resolved it and I've moved on. So I have to say, for a vendor with a 40-year relationship, I've had all pretty much positive experiences.
Well, that's great. I mean, just being able to maintain that relationship with you for years. And I know you and I talked yesterday about how we've seen each other's emails over the last, I've only been at the company 5 years, just seeing your correspondence with us over email has always been great. Having you as a user of our systems and an ally has been great. We really want to thank you for using the systems. It's just been a great relationship with you, and we really appreciate it.
Thank you. I appreciate it. And it's been fun over the years to watch the systems evolve, in terms of, larger chambers and faster cycle times and stuff like that. So I know you guys haven't been standing still. You guys have been evolving and improving and stuff over the years. And I'm old enough, I've seen a lot of those changes. But
well, great. That's great. Thank you so much for stopping by the booth. And again, we appreciate it, and we look forward to working with you for a lot longer.
Oh, you're quite welcome. Thank you so much.
Thanks.